I would tell the person, if you have someone, if you have a friend, a girlfriend, everything, talk to them about their experience. Talk to them about their experience. That's one thing that you can do, all right? But the other thing that you can do too, you need to do your research. You need to do your research.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. David Matlock with me here today. Now, Dr. Matlock has treated countless A-list stars, including winners of the Academy Awards, Grammy Awards, Golden Globe Awards, American Music Awards, Primetime Emmy Awards, People's Choice Awards, MTV Video Music Awards, as well as many others. His clientele also includes foreign presidents, royal families, Fortune 500 company executives, and billionaires. Not only has he treated patients from all 50 states and over 70 countries, he has also trained over 435 surgeons from over 45 countries in female genital cosmetic surgery. He has performed liposculpturing over the past 33 years and treated over 10,000 patients. He is also the pioneer of female genital cosmetic surgery and has performed thousands of cases over the past 27 years and also holds 13 registered trademarks. So Dr. Matlock, welcome. Glad to have you here on the show.
Thank you very much. I greatly appreciate it. Pleasure to be here.
Great. So let's dive right into it. Tell me, how did you first get interested in medicine, and particularly the aesthetics world?
Well, I really got interested in this aesthetics world. It's a very interesting concept. So here I am in my training as an obstetrician and gynecologist, doing obstetrics and gynecology. I had a plastic and reconstructive surgeon come to the practice in about 83, well, I would say about 84, 85, all right? And 87 is when I really made that big transition. He came and he said, listen, you have all of these women, you need to be doing liposuction. So at that point, liposuction basically came into the country maybe about 83, a little bit earlier from Europe. And so I said, well, I'm too busy doing all this obstetrics and gynecology. And so one weekend when I was in the hospital, doing all this obstetrics and gynecology and all this, I couldn't get out, I couldn't leave. And then I said, hey, I called my buddy, the plastic surgeon, help me get into it. So he said, here, I want you to read these 3 textbooks. I want you to take these courses, finish that, come to me, and I'm going to proctor you. So that's exactly what I did. So after 6 cases, he said, you can go out on your own. You don't need me anymore. So then here I am with this aesthetic practice, focusing on liposuction, all right? All things liposuction. And then what happened, women would say, oh, I want my breast done. I want my tummy done. Well, I don't do any of that. So I referred it to him. Very smart of him. So he got an instant patient population, me being grateful for what he did and referred him that other business. So that's, he's long since retired, but that's how the whole thing happened and how I got started in performing liposuction. So now I do all things liposuction, Vaser high def liposuction, Brazilian butt lift, just everything about liposuction.
Got it. Now, I want to talk a little bit more about what really differentiates your practice from others in the industry. Now, in your introduction, you're working with really A-listers, like really high-end people from companies or politics. So talk a little bit more about that. Like, kind of how did you get into that clientele?
Okay, what I will tell you is that I have worked on some of the most influential people in the world. All right. And I think that you have to gotta be good. Good, you're personable. And what I tell people is that I'm in that clique. You're in the know. Okay, you're in the know. It's just one little story that my wife and I were sitting in our theater watching the Academy Awards. So one of my patients were up for the Academy Award. And she had laser vaginal rejuvenation. So she was named as one of the celebrities up for that Academy Award in her category. She won it. We were sitting in our theater watching her come up for her award. My wife turned to me and she said, Now she had laser vaginal rejuvenation. She turned to me and she said, "You think she's going to thank you?" I turned to my wife and I said, "I don't think so, dear." So the thing is, you're in that clique. That's it. You're in that clique. It's not something you can market for or whatever. You are in that clique. You are known for what you do, and it's that whole word of mouth referral. So that's really what it's about, and that's how I really got into this whole thing. It's just, but it's just, it's amazing. But you're in a clique. You just can't get in it or whatever. You're in that clique. That's how.
Got it. Now, what would you say as far as the needs of your patients that you're working with right now? Would you say that their needs are different from, let's say, your average person looking for cosmetic surgery, or would you say that it's vastly different needs?
And no, I will say that, I mean, the needs are the same per se, meaning, hey, you need lipo, you need lipo. You need some skin tightening, you need skin tightening. If it's a female genital plastic surgery, well, then you need that particular type of procedure. So, the need isn't any different, I would say. But I would say that that's celebrity per se. I mean, you can understand them doing this. I mean, that's their business. Their business is about looking good, feeling good, everything. That's the business, okay? I remember one celebrity that I had, and she, for liposuction, there's a time when you got to say enough is enough. She came to me and she literally had liposuction 7 times. And I said, look, we can't continue doing this. I said, you need to exercise and diet. She said, why should I exercise and diet? I have you. So I said, I can't do anymore. Just can't do anymore. So that's it. I remember one particular celebrity who came in and she was up for an Academy Award, Golden Globe Academy Award, and she didn't get either one. But when she came in, and what she wanted was this sculpture. She was thin, but she wanted a nice butt. So she wanted this sculpture augmentation to the buttocks. All right. She didn't win the Academy Award, but when she sang, she looked fantastic and beautiful. So that's what it's about. But these patients will come in, and the thing that really sets them apart, I would say, I mean, they're paying crazy money. I mean, it's just beyond me, okay? Beyond me for that butt. I mean, for that product, it's expensive. She paid $129,000, but she looked beautiful when she sang at the Academy Awards.
Yeah.
So you see those kind of things, it can be kind of over the top, but I can understand that, this is for their profession. You're doing this for the profession. Or they may be coming in for a particular procedure where they have to look nice, tight, sculpted, and everything. And we'll do this laser high def where we're defining and sculpting out the muscular structure of the body, of the abs, the six pack, the pecs, the triceps, deltoids, biceps, all of this, that they want.
Yeah, now actually, that's a great segue. I want to ask you about your advanced surgical bodybuilding procedure, because when people think about plastic surgery, they're probably thinking about something like a butt lift, like a breast augmentation. But I think very few people have heard of using cosmetic surgery to sculpt out the muscles and make you look more muscular. So could you talk a little bit more about this procedure?
Yeah, so with that, they call it a laser high def procedure. And what you really have to understand about that, we're not what we say etching or whatever, just drawing on the body. You have to have the muscular structure up underneath. So we're bringing out your muscular structure. We're defining your muscular structure where, like, say for the abdomen, you don't have the definition of the six pack, of what we call the transverse tendinous insertions, the linea alba, linea simulinaris. We're sculpting all of that out and bringing the muscular structure out. You got a layer of fat, but we have to bring that down. Okay, because the problem is you don't see the muscles. You have the muscles up underneath. If you don't have the muscles, I can't create it. You have the muscular structure, I can create it. So it's not just pulling something out of the air. You have to have that muscular structure. I'm bringing it out. You have too much fat over the area. You don't have the right portion of where that fat is, where the tendons insertions are, of the six pack, of the sides of the ab, down the center. We're creating that. Okay, creating that. You don't have the obliques. We're defining all that out. The biceps, triceps, deltoids. You got too much fat there at the bottom part of the deltoid, so you don't see that pop. You don't see that bulk. We can bring all that out. You have to know and understand the muscular structure of the human body. And you have to know and understand how to bring this out in this base or high def procedure. As far as advanced surgical bodybuilding, that one big thing that guys want is the augmentation of the pec. So then I will go in, I will define the pec, bottom, sides, outer border. I've got it nice and defined, separated out from the abs, okay? All right? Nice and defined. Then I'll take that fat, 95% of the fat is alive. I will process that fat, purify, process, and concentrate that fat, and then I will strategically inject it into the muscles of the pec, and it's a filler, and it's popping that pec. Okay, so that you get a really nice defined pec. Oh, the top part, I'm flat, I'm not bald. You can really build that up. It's really nice and really natural, and nice and natural to look and feel, and it's maintained.
Wow, that's incredible. I've never heard of that before. So
Yes.
I think a lot of people probably haven't heard of that as far as like what the capabilities are for that type of procedure. But it almost sounds like it's very, in some situations, targeted liposuction with surgical precision. I guess you could almost say similar to that.
Correct. I would say that. That's exactly it. But you have to know what to do, how to do it, how to achieve the results.
Got it. Okay, now I want to go kind of back to you as far as you've pioneered the female genital cosmetic surgery. You were one of the first to bring Brazilian butt lifts to the US. You have 13 patents. I mean, it sounds like you're really on the cutting edge, but can you kind of talk a little bit more about what maybe caused you to want to be that pioneer, to bring in these new procedures, to have these patents? I'm really curious.
These 13 trademarks, not patents, trademarks. Okay. So with the United States Patent and Trademark Office, well, first of all, in it coming from the history of an obstetrician gynecologist, okay, board certified obstetrician gynecologist, and what I felt was that if women would come and say, well, doctor, what we would do as an obstetrician gynecologist, this woman, let's say, has had 4 children, and she's relaxed, or she has stress urinary incontinence. Normally what the doctor is going to do is just treat the stress urinary incontinence, okay? If the patient says, sexual gratification is different or has changed, and you can understand if a woman has had 4 kids, 3 kids, or an 8-pound baby, 10-pound baby, and delivered vaginally, or even carried, had a C-section, there's just the muscular structure, okay, the pelvic floor, the muscles at the top of the vagina, bottom, and outside are damaged. The vagina is larger. The vagina is relaxed. The vagina isn't functioning as it would as if she didn't have children. But the gynecologist would say, don't worry about it. It's a normal part of aging. Forget about it. I got stress incontinence. Do Kegels. Kegels don't work. Women have told me, if you look at the scientific research for Kegels, basically it's for mild conditions of stress incontinence, okay, and it could help a small percentage of patients. That's what it's for. I can pump the muscle day in and day out. I'm not going to build it. That's what Kegels are trying to do. You're just not going to do it. So from that, I said, let me listen to women. Let me help to correct this. So what I did, starting with my laser vaginal rejuvenation for the enhancement of sexual gratification, I said, let's listen to the woman. Here's her functional complaints, all right? And here is her other complaints as a result of having children that didn't decrease sexual gratification. So let's do a procedure based upon a standard existing gynecologic surgical procedure and laser a anterior posterior repair for the top, bottom, and outside, for the support of the bladder, urethra, rectum, okay, and build up the perineal body, where people have had episiotomies, as are they had a tear, the obstetrician gynecologist didn't really repair it or have repaired it per se. So I said, let's look at this. Let's concern ourselves with form, function, and appearance. So that's what I did. And because of the fact that I had training in aesthetics, in doing liposuction for years, I said, let me apply some of these techniques to my vaginal surgery. Let me apply the aesthetics, where I see obstetricians and gynecologists doing a vaginal surgery can be very messy, can be very, let me just throw this back together. I've seen it, okay, I've seen it. It can be a very bloody surgery. Vaginal surgery can be a very bloody surgery. Liposuction is relatively a bloodless surgery using this tumescent technique. I use a tumescent technique, okay, for this. I know that this vaginal surgery is uncomfortable. I would do a pudendal block, okay, with a half percent marking with epinephrine to give them 18 to 24 hours post-op pain control. They had your general, they wake up, hey, no pain for the entire day, not until the next day. So I incorporated all of this. I wanted to restore the vagina into its normal functioning state. So I wanted to enhance sexual gratification. I wanted to decrease the internal diameter. I wanted to build up the top of the vagina, anterior, posterior, and perineum. I questioned the woman I asked the woman, how tight do you want to be? What do you want? All right, I wanted the woman to come in under her own volition. What do you want? What do you want? I want to be like 16. I've heard it over and over and over. I've treated patients from all 50 states, over 70 countries. What's the most famous? I want to be like 16. Okay, we can see that, we can understand that. At a point I looked at, is there anything like what goes on for the male? For the female, the male's got Viagra. I looked at one point, I think it was 200 some odd different devices. There's male impotence. I mean, everything for the man. Is there something similar for the woman? Or the knowledge and research for the woman? No. People say, are you a feminist? I say, yeah. In this regard, I'm a feminist. Okay, so that's what I did. So I did this for that first patient. Okay, and the patient, after healing in 6 weeks, she came back. She said, doctor, guess what? I said, what? She said, sex is great now. I said, oh, okay, fine. I just followed way in the back of my head. Then the husband came to me. He said, doctor, guess what? I said, what? It's like having a new wife. It's like having the same woman, but a new wife. So, okay, yeah, that's good. Followed way in the back of my head. They sent me flowers. Then what happened, other patients started coming in. Hey, I want this laser vaginal rejuvenation. Now, why I use the laser is pinpoint, is precise, and I developed a bloodless technique. I know how bloody it is. By using the laser and everything, pinpoint, precise, a bloodless technique, using tumescent solution into the mucosa, top, bottom, outside, using meticulous suturing and everything, all of that, applying plastic surgery principles to the vagina. This is what happened. So then after that, the patient after patient after patient, then I said, well, wait a minute, there's a need for this. Okay, there's a need for this. So I simply went public with a local ad, laser vaginal rejuvenation for enhancement of sexual gratification. So then what happened, we were inundated with patients, and also the media. Okay, if you look at my media, Harper's Bazaar, Cosmopolitan, Vogue, national, international, television, I have been on everything, nationally and internationally. So what I saw at that particular point, I said, you know what? Sex sells. When they say sex sells, sex sells. I had no publicist. I had nothing. The media was beating down the door. Now, we were media friendly. If they wanted to come into surgery with the patient's consent, I'd have them in surgery. They can see procedures. They can talk to the patients and so forth. I've been in everything. Every magazine you can think of, national magazine, Cosmopolitan, Vogue, Marie Claire, Harper's Bazaar. I've been in it. Okay, I've been in it. So now I knew as a result of that, then as a businessman, I said, hey, we have sex cells, we have a symbiotic relationship with the media. I need them and they need me. And I said, the other point, okay, where's the science? Well, wait a minute, I'm starting from a procedure that has all this literature. I'm modifying this procedure and I'm focusing on correcting that, being aesthetically sound, restoring function. They want to be like 16 or like 16, restoring function, okay? I wanted the woman to come in under her own volition. So that's how this happened. And then as a result of that, people say, hey, I don't like my labia minora. I don't like the length of my labia minora. Now, there wasn't a textbook I could go to. There was nothing I could read. I had to use animal models and so forth and develop this procedure, but listening to what the woman wants. So I listened. They were my instructor. They were my teacher. They were my guide. I listened to what the women want. Hey, I don't like my mons pubis is too big. It's too fatty. Let's go down to the labia majora. Oh, I do liposuction. Let me do liposuction in mons pubis and labia majora. Hey, I don't like my labia majora too old. It's too saggy. It's too wrinkly. Okay, here's techniques that I developed out to reduce the labia majora to make it more useful. So ultimately, I developed out. And hey, my labia majora are they're not full, they're not plump. I do liposuction, I process the fat, inject it into the labia majora, make them nice, youthful. When I said, what is this all about? It's all about youth. What do the women want? It's all about youth. It's all about restoration going on down there. Okay, men have everything, and the women didn't. Okay, so that's what it was about. So then doctors started coming to me. Hey, I want to be trained. I said, okay, fine, let me do it. I said, you know what? This isn't it yet of what I want to do. I have an entire cosmetic surgical procedures or cosmetic surgical program for the vulvar structures, vagina, and so forth. I had all that. So I said, you know what? I'm going to hold on that when doctors came. So in 98 to 2000, I went to University of California, Irvine to get my MBA. All right. And so I said, buddies of mine say, hey, you're a good businessman. Why do you need to do that? I said, because, I feel that I'm holding myself back. So when I had my interview at University of California, Irvine, I was sitting across and I had a female professor. She had to get up and go to use the phone or something. So I looked at my essay that I wrote and I saw in yellow, I seek knowledge. It was highlighted in yellow. I looked across and saw it. I said, I'm in. I was in, here I am, MBA. So at that point afterwards, then I developed out a training program. And I have trained doctors from 435 surgeons, gynecologists, plastic surgeons, okay, from 46 different countries. Okay, at times I would have 10 doctors there. So there was a company that they did all the marketing and so forth and everything. I did the training. All right, they had a day, didactics, 8 hours in surgery, seeing me doing this procedure, and a half day the next day on Sunday, doing all the procedures with inanimate tissue. So that's the whole thing. I did that, and I did that for years, to the point I said, okay, that's it. I'm tired of doing it. That's how it all came about.
That's a fantastic story. I mean, just fantastic journey that you've gone on all the way up to where you are now. And I'm actually really curious, because when people think about medicine, medical surgery, they always think that there's a specific protocol, step-by-step protocol that is in place for that. But kind of to your point, you talked about this before, but if you can speak a bit more, what role do you believe creativity plays in the way that you approach the care that you give to your patients?
Yeah, that's what this is all about, really. That's how this came about, that creativity, sitting down, thinking about it, naming everything, okay? But also with a business degree. And what I say with an MD, MBA, people look at you differently. That's what I found. They look at you differently. They listen to you. You can talk to business people. It's a different thing. And then from that, basically what I said, I can capitalize on this. So yes, you get some flack her thinking like that, but I can capitalize on that. Well, I would say that to me, it's fine. I look at Becker's Review, I see these 5 same physicians, and they talk about them every once in a while. They're multi-billionaires. They maybe own healthcare programs, so that I see there's one guy who has multiple patents, and he was an orthopedic surgeon, but he invented all of these instruments, everything. I mean, a multi-billionaire. So they're businessmen. They looked at that. So I look at the same thing. That's what I did. I saw an opportunity as a businessman, capitalized on it. Now look, the research is there. I, with other doctors, we have a textbook out of female genital cosmetic plastic surgery. We have multiple papers out there. I knew the research would catch up. I thought that you'd take some flack for not having the research per se, but I knew the research would catch up. I wanted this to go international. It's international now. It's multiple societies of female genital plastic surgery throughout the world. At one point, I traveled the world just giving lectures. In my program were the company that I partnered with, Japan, Europe, everywhere. Went everywhere, giving lectures, $130, $140, $150 doctors, Korea. Okay, so they're just spreading that word. It's all over the world. It's all over the world. So
yeah,
I'm just a pioneer and a father of female genital plastic surgery.
Yeah, fantastic. Now, I'm sure that throughout this entire journey, there's been a lot of misconceptions about the kind of treatments that you provide. So what are some of those common misconceptions that your patients come to you for, thinking something in their mindset that they believe it's this, but in reality, it's actually something else completely different? Like you kind of talked about people coming to you like, oh, I want to be like I was when I was 16. Is that a reality or not a reality? I'm sure you have other comment with realistic expectations.
Yes. That's very important. That's very important in my specialty and what I do. All right. You have to make sure that that patient knows exactly what they're doing. We have extensive consent. I take a tremendous amount of time to make sure we are 100% in sync. If that patient, I would say, is unrealistic, I won't do it. I just won't do it. If she's unrealistic, or can't get her to be realistic, it's better just turn that patient away. I said, I don't think I can help you. I don't think I can help you. I remember one particular celebrity who came in, and I have to be a little careful. One who came in, he wanted something done. Let's just say that. He wanted something done, okay? And like this and like that and everything and all that. I said, no, that's not gonna work. I mean, we can't do that. You're not being realistic and everything. Oh, well, you're the best. I said, but you gotta be realistic. And so I listened to him, I dictated something for him and sent it to him and said, I can't help you. I'm sorry, but I can't help you, So, and I felt that it was best just to leave it alone. It's a substantial amount of money, but leave it alone. I said, no. He came back, doctor, I understand. I got it. We went back through everything, fine. Came in, had a surgery, everything's great, fine, we're good buddies. But I said, no. And he tried to reason with me. I said, no, I'm not gonna do it. I'm not gonna do it. He came back, very realistic, understood, and everything's fine.
Yeah, just about making sure that expectations are set correctly from the beginning.
Absolutely, you better do that. It's very important, very, very important. And I would say also, with the celebrities, but you just gotta be honest with them. You gotta be honest and open with them.
Got it. Now, Dr. Matlock, where do you think that the future is going in your particular space, the cosmetic surgery space? Where do you think the future is looking bright? And I'm really curious, since you're really a pioneer in the space, what your answer would be as far as where you think the future is going.
Well, I think some things, especially dealing with skin, in some of the devices out there, I won't go with names, but some of the devices out there and some that I use, And the thinking now, just talking about skin, of what we can do with skin, of the machines that we have. I'm very, very impressed with that, okay? Very impressed with that. That's that. If you really want to go out there, you really want to go out there. I'm very impressed with Elon Musk, the robot that he has.
Mm-hmm.
I mean, I'm going to write a letter to him and tell him, I mean, somehow, if I can get to him, that I would like for him to allow me to have one of those robots and have one of those developers and let me teach that robot how to do liposuction. That's what I want.
Mm-hmm.
That's what I see. That's where I see the future. And I see the future also with AI. And I continuously look to see, I use AI. I believe in AI. You know, in some things I would do and I would write and how I use it and show other doctors or give other doctors. They said, that's brilliant. I mean, you're your own marketer. You're your own PR firm. Okay. But I'm simply know how to prompt chat, respond like the chief medical officer, copywriter, content strategist, and I use it consistently. All right. To do a blog. They said, this is a fantastic blog. I don't tell them I'm using chat. I just want them to look at me and think that I am a genius. Okay. And I said, this is too good. I tell my wife, I'm not going to say anything. She said, don't say anything. All right. I would write something. So that, and I'm amazed at some people that I've told, I said, you need to get into this. My wife's a nurse practitioner. I told her she's an avid believer in chat. All right. What she did on the home in Arizona, where we were told by a friend who lives in the community, a new community, that the developer went down on price of our home. I mean, okay, that model, she said, told chat to respond like a real estate attorney. Take all this information, put the PDF, put it in there, all the information, and give her an answer. Okay, respond, write the email to the developer. We did it, here's $40,000 back. Here's $40,000 back. Did we go to the attorney? No. Did we consult with the attorney? No. We consulted with our good friend, ChatGPT. And that's what happened. Mm-hmm. So I could go on and on and on about it, but I believe in it. I believe in it, you know, and doing an op report and things like that. So that is really, I'm looking how AI is going to affect what we do in medicine. All right. So I'm looking at it, everything AI I read about. If I'm looking at being a futurist, I'd like that robot. I'd like that robot from Elon Musk. Have you seen it?
I've only heard stories about it. I don't know that much about it.
You got to look at it. And I've been to the Century City Mall and just stood up there looking at it, marveling at it. It really looks cool. It really looks cool, okay? And it can do. I see what it can do, but they're looking at it to do manual things in a factory. I said, you need to look at it to do what you can do in medicine. That's what I'm saying. But to do it, and then I say, well, would a patient let you do it? You know, would they do that? I said, it can do it much more precise than anybody on earth. Okay, so that's what I'm looking at, and I'm going to give it a try.
That's fascinating. I think as far as when I ask people about the future, where they think it's going, I think you're the first one to talk about AI when it comes to medicine. So I think it's a fascinating answer. Now, Dr. Matlock, I have one last question for you, but before I ask it, I want to point people to your website at www.drmatlock.com. The last question is, what is the most important piece of advice you can give to someone who is looking for a plastic surgeon, but isn't sure who to choose or even how to choose that right person for them?
I would tell the person, if you have someone, if you have a friend, a girlfriend, everything, talk to them about their experience. Talk to them about their experience. That's one thing that you can do, all right? But the other thing that you can do too, you need to do your research. You need to do your research, all right? And what you need to do is do consults with that physician or do your research. I like this person, okay? I feel that I want to work with this person, look at his work, see if you like the work, okay? Look at all the pictures before, after, okay? And then what you can do a consult. Do you guys mix? Do you come together? Do you see eye to eye? Okay, that's what you should do. That's what I think. I think too, a part of my success, I'm a very personable guy. I'm your buddy. I'm your friend. You know, we would, I mean, how I treat the patient. I am not a god. I don't portray a god complex. I'm a human being, down to earth, just like you. That's what they see. That's what they see. Okay, so that's it, and it's about how you portray. Some of these doctors, they think they're God. They're not. I mean, they act like that. They act like that. Their head is up in the sky, but I'm not. So that's all a part. That's all a part of success. I can relate. I hug, whatever. So that's what you have to look at. That's what you have to feel, see, get that vibe. You got some other people who had a personal experience. Hey, you look great. Who's your surgeon and everything? How is he and all that? That's what you should do.
Perfect. Well, there you have it. Dr. Matlock sharing his expertise. Now, Dr. Matlock, where can people contact you in your practice?
They can contact me at drmatlock.com, drmatlock.com.
Okay, perfect.
We also have another new venture that I've done. It's our Aesthetic Surgery Institute and Med Spa, aesthetic.com as well. VISTHETIC.com.
Perfect. Well, great. Thank you, Dr. Matlock, for being on the show and sharing your message.
Thank you very much. I greatly appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.